Hey, I'm Jamie. I'm here to do Blog 3 from Module 3, Nursing Leadership Skills. I am currently a labor and delivery nurse at UNC Lenoir. It is a 261-bed nonprofit hospital. I'm a new nurse. I've only been a nurse for about 3 years, so I've not had the opportunity to be in a leadership or management position at this point. However, after completing the leadership skills questionnaire, on paper it seems that I would be a good leader, as I scored very high in administrative skills, and I also scored high in conceptual and interpersonal skills. However, sometimes on paper that does not correlate to what you would do when you're actually placed in that role. We have definitely a matrix organizational structure, meaning we have several departments in the organization and subsets of subsets. The goal is to all horizontally and vertically work together for the main goal of quality patient care. At this point, being a staff nurse, I'm towards the bottom of the organizational matrix. I don't look at this as a negative thing. I look at it more as laying the foundation for great patient care. That's the main goal for bedside and staff nurses. If I were to accept a manager position, this would definitely be a vertical slide in the organizational structure. We do try to work together horizontally. However, it does often occur that instead of those lines that we see in horizontal care, there's often gaps in terms of transdisciplinary collaboration. There's often misses in patient care, continuity of care. This could definitely be improved and is a role of the nurse manager to ensue this continuity along those horizontal aspects. At UNC Lenoir, we use an integrated model of healthcare, providing both a scientific and holistic approach to patient-centered care. This is also beginning to transform as we have recently merged with UNC Health Systems, so I'm excited to see what entails for our future on all levels, really. As the textbook states in Chapter 6, the integrated healthcare model has evolved to accommodate current issues in healthcare that are at hand, and it consists of a complex network of services available to treat patients at the lowest possible cost, but keeping primary care at the focus. If I were to assume a position as the unit manager, the job description and role would drastically change from that of a bedside nurse. From the list of nursing management skills located in Chapter 7, coordinating, organizing, and planning would all be instrumental in securing staffing as a resource. With the current nursing crisis, staffing floors and units, staffing the whole hospital in general is a daily problem for managers. According to Daly and Matzel, by using a transdisciplinary approach, there is an increase in job satisfaction and patients report increase in quality of care. In order to be an effective manager in labor and delivery, I would need to work most closely with my own staff nurses. I feel this is something that often gets missed. Managers don't often work close with their own nurses to see what's actually going on with their units because they are more concerned with what's going on in the hospital as a whole. I would have to expand horizontally to other departments that work closely with the labor and delivery units, such as the operating room, the emergency room, the lab, blood bank, central supply, equipment. I would also have to go in a vertical direction and make sure that the nursing supervisors, the nursing directors, CEOs, physicians, that they're all abreast any problems, suggestions, or any issues that are at hand. You would have to keep them notified. That would be a primary task as the nurse manager. I believe to have an effective model, the matrix should flow in both directions, both horizontally and vertically. Every department should work together to benefit the patient as a whole. And having an integrated model of care would benefit the hospital, because this would be able to take specific patient needs into consideration. And that's the end of blog 3. Thank you.